Well, thank you, Mark, for allowing this to be live streamed. I'm Matt Mehalik. I'm with the Breathe Project here in Pittsburgh, live streaming from Mehalik Cook's Sustainability Salon. Thank you, Maren, for inviting us to be here tonight.
Thank you for coming and sharing.
Yeah, appreciate it. I was just going to give a quick update on some facts and activities that are planned related to the Clairton Coke Works. So, how many of you really enjoyed the Christmas present that U.S. Steel gave all of us, which was a big party and explosion that nobody really knew about until 2 weeks later? So let's just start with some basic facts. At about 4:00 a.m., there was an explosion at the Clairton Coke Works in one of the control rooms. The control rooms are the places where they run pollution control equipment. The facts that we know, that we've learned, it took us almost 3 weeks to learn this, was that this was in one of the control areas where they remove oils from coking gas. So when you bake coal, gases and oils and other pollutants and metals are driven off, and the requirements for U.S. Steel are to strip off these pollutants before they can reuse that coking gas. There's some aspects of coking gas that they use in the Edgar Thomson Steel Works, they reuse in the Irvin Works, and they use in run the coking ovens themselves. So there was an explosion in a compressor in one of these units to strip off the oils. And it resulted in a massive fireball that blew a hole about 100 feet wide in the roof of this control area and bent some steel beams. Now, we didn't know that. We hadn't heard anything. All that was posted on the Allegheny County Health Department's Facebook page later that day on December 24th was there was a fire at the Clairton Coke Works and we're monitoring the situation. Okay, and that's basically,
don't expect any problems.
And don't expect any issues. So that was the way things existed for 2 weeks. In the meantime, all of the pollution control equipment that strips off the oils and the desulfurization unit, because that is the unit that follows the unit that stripped off the oils, that was all shut down. So the plant is operating without those controls. So there were 6 air exceedances that started happening after December 24th. The most extreme one being on December 28th, where the sulfur SO2 emissions were double, essentially, the legal limit of which you shouldn't be crossing. So it was twice as bad as what the limit is. Still, the health department didn't say anything. They apparently were working behind the scenes with U.S. Steel, telling them that this was happening, and what U.S. Steel did was they stopped using the untreated coking gas to operate the ovens at the Coke Works and diverted it. We were told it's still being used to operate the Irvin Works, and it's being flared at a flare called the Peachtree Flare, which we haven't really identified where that is yet. They've been substituting natural gas as a fuel to run the coking ovens, but they've still continued to operate. Now, what we also know is that the installation permit for the Coke Works requires them to operate pollution control equipment. So the health department is somehow not following the provisions of what is legally required for requiring the operation of this equipment while that's been operating. We at the Breathe Project met face-to-face with the health department director on other matters, like the ongoing lawsuit with U.S. Steel involving the Clairton Coke Works from violations that occurred in the middle of 2018, in the second quarter and the third quarter, and U.S. Steel was appealing some of the fines and sanctions on that. And they didn't tell us anything about this. Okay, this was on January 3rd of this year. So we talked with them for over an hour over multiple issues, and this wasn't even brought to our attention. It wasn't until a week later at the Board of Health meeting on January, was it the 8th or the 9th? I'm trying to remember. It was either I think it was the 9th. It wasn't even Dr. Hacker, it was Jim Kelly, who's the head of the Air Division, basically said what I've told you right now. And the only question that was asked by a member of the Board of Health was, is U.S. Steel being cooperative? And the answer was yes. Okay. I was sitting in the audience there, and when I heard that, I immediately had to get on Twitter and say, the only question that was asked by the Board of Health was, is U.S. Steel being cooperative? Okay. And after that event, and after multiple, like Mark, I'm sorry, Mark was, were you at that meeting?
I was at the meeting.
Mark was at the meeting. In addition to other activists, we heard this, and we immediately knew something was very wrong of what was happening. We went back and reviewed the breathe cam that showed that this just wasn't a little fire, it was a massive fire. So all of you can do this. You can go on December 24th at 4 o'clock in the morning and play the breathe cam, zoom in on it, and you can see the fireball that blew up. We also started gathering evidence. The high incidence of smell Pittsburgh reports that were occurring subsequent to that. And then the monitoring data, checking to see how many times there had been violations. So we believe that the response to this, so the health department on that same day at their meeting issued a public health alert basically saying people should stay indoors. So that's really been the response from the regulator and the organization that's supposed to be protecting the health of our region. So we think that that's not been adequate, and we haven't heard anything from U.S. Steel. So we've been organizing and getting a campaign started, and so we are having a press event that's occurring in Clairton on Wednesday of this week. We're inviting people from the community to come and speak. What really lit a fire under this was, as part of a regular schedule, Dr. Deborah Gentile, who had been running health screening for asthma in Clairton School District, as well as Woodland Hills and others, happened to be there in the middle of the week last week, and she sent me a message saying she was in tears because kids whose asthma had been controlled for months, those children were struggling with breathing and they needed to have their medication adjusted upward. We helped pull some information together on that and get that out there through a press release, and the media has picked that up and has accelerated that message around. So that's really mainly the first time that most people heard about this story was about the asthma, and that occurred in the middle of this past week. Maybe Wednesday of this week is when the story started to pick up. Now we know that U.S. Steel and the health department and people in Clairton recognize that they have not been forthcoming with information for almost up to a month after the event. And so Clairton City Council has declared a meeting to have basically a public meeting about this, and that's happening this coming Tuesday. I think it's at 5 o'clock at City Council Chambers at the Municipal Government Building in Clairton. And Dr. Hacker has been invited to testify at that meeting. So we don't know what's going to be said there. But what we do know is that we will have people there, and we will be making sure that questions get asked. And we're also going to make sure that no attempts to sweep this under the rug are going to take place. Wednesday also, and then I want to credit Summer Lee, who sent out a tweet about this that really lit up activity as well, basically saying if the health department closes down restaurants that threaten people's health, why, and that's one small restaurant, why do they allow an entity that affects the health of millions of a million and a half people in our airshed, and allow that to continue. So that's a key question. The response has been, well, they can't really do that, but we really don't. But we believe that they really can. They can, as the regulator, ask the facility to go into hot idle. Hot idle means you just don't bake Coke you don't bake coal anymore to make Coke. You just, run your operations so that your ovens don't crack, but you don't need to put coal in there and generate coking gas that's untreated for all of us to breathe. Yesterday, the county health department, because of weather, lower mixing heights, thanks to Mark's identification of that, we sent this along to the health department. We're trying to help as well as hold them accountable. They issued a general public health alert, not just for the Mon Valley, but for everyone in Allegheny County, that there could be air inversions and there could be high levels of sulfur dioxide in our airshed. And so that's basically where things are, is that there's no plan, no one has articulated a plan, nobody has communicated when this will end, nobody has communicated how the polluter, the entity that is causing this, is being held accountable. No messaging on that whatsoever. So what I'm saying here tonight is this coming week, that's going to change. First of all, on social media, hashtag Let Clairton Breathe. People are using that. People, if they're experiencing health symptoms, they are putting them on Facebook pages of the health department, on the Breathe Project's webpage, and on other social media, so it's at least documented. So if you are experiencing respiratory issues, please post that. Yeah, question.
How many people do you have equipped with this, with them, who are committed to doing that, basically?
Committed to doing what?
Well, making sure that those posts are in places that the health departments can see.
Well, I mean, we want this to be as broad as possible. And I know after the media event on Wednesday, it should be picked up fairly widely. And getting the word out tonight is also important. Another hashtag is #HotIdle. So that's something else we want people to get the word out about, because those are reasonable requests for an entity that is harming the health of all of us. They are operating outside of their provisions of their installation permits, and that puts the health department at risk. That if we continue to go outside of what's legal, the health department itself can lose its sanction to regulate our air. And what would happen is it devolves back to the state or even the federal level for something, for them to come in and take that authority away. So we need people to speak up, we need people to show up, and we need people to know that it's unacceptable for this to continue. We need a plan, we need to protect people, particularly people who are already having respiratory and cardiac issues, and children. And we need people to be held accountable. So with that, I think, Mark may have it. Yes, please do.
The live stream.
Yeah.
The Breathe Project has been collecting quotes from, it's fun, collecting quotes from people that are posting in Clairton, on the Clairton, on the health department's webpage,
Yes.
I think.
Right.
Deb has been finding those,
Yes.
you've been finding those.
Yes. And we're collecting them.
They're collecting them on the Breathe Project Facebook page. They're very compelling. Many of you here have heard me talking about my inversion documentary and about this air quality issue that we have, and sometimes it's hard to get people in affected areas to speak candidly about the air quality. And this fire has given them the galvanizing force, the nudge that they needed, the reason, the courage that they have been waiting for generations for, to come together and speak out loudly and publicly on this issue like I have not seen before. And I've only been covering this for a couple of years, but I think it's rare in the arc of this issue. So this is a transformative time in how we work with Clairton Coke Works. and every push from the community pushes us faster in the right direction.
And people here living in the East End, you know, I know you smell the bad air. Think of all those times in the summertime, in the evening, or even in the winter if you go walking and you smell that bad air. It's because of SO2. The situation is much worse now, and it's time for us to put a stop to all of this. So your voice and participation in this is critical. We need everyone to support the sanction that this is unacceptable. People should be protecting our health. People responsible for that needs to do their job. Leadership needs to step up and do that. And we need an end to a situation like this. Clearly what happens is, what we're seeing is all past claims of entities that say that they care about residents of Clairton, they are not. An entity that would care would have been forthcoming from the beginning.
Sure.
There would not have waited 3 weeks to let people know. Okay? The evidence speaks out that they really don't care about the community. They only care about the profits they make by running equipment that is illegal, and this situation needs to stop. So that's what I came to share tonight. Thank you.